during this pandemic. So today we have more Ohioans with COVID in the hospitals throughout the state than we've had at any other time during this pandemic. We're going to hear today from some of our hospitals, some of our zone leaders. We also will hear from General Harris, who will tell us how that deployment is going. But before we do that, I think it's important to emphasize something. What we're seeing in our hospitals filling up, our emergency rooms, is being driven by people in Ohio who are not vaccinated. And the numbers clearly show that. If you're vaccinated, the chances of you ending up in the hospital are pretty darn slim. If you add a booster shot, if you're eligible for a booster shot and you add that booster shot, that reduces your odds of ending up in the hospital even more. So as we go through this and we talk about some things that are tough to listen to, as far as the number of our fellow Ohioans who are in the hospital because of COVID, I think it's important not to panic. I think it's important to all of us to work towards doing the things that we have to do to lower this count in our hospitals. But I felt it was important during this week between Christmas and New Year's, when this information came out, I thought it was important to share it with all of you. Looking at the data since June 1st, we picked June 1st because that is when I think virtually everybody in this state had the opportunity to get vaccinated. Since that time, our data shows we've had 35,962 people who have been admitted to the hospital because of COVID. Of those, 2,687 of those were fully vaccinated. 2,687 were fully vaccinated. So that means that 92.5% of the people in the hospitals have not been vaccinated. I think it just, again, confirms what our medical community has been saying to all of us. And that is, in these vaccines, we have a very, very powerful tool. And it's a tool that almost without exception is going to keep Ohioans out of the hospital. So again, if you've not been vaccinated, please think about being vaccinated. It is your choice, but the evidence is abundantly clear. This is the best way to stay out of the hospitals. Let me turn to the hospitals. Since the pandemic began, we have worked very, very closely with our Ohio hospitals. And I just want to salute now the men and women of these hospitals who have done an absolutely phenomenal job. The nurses, the people who are keeping the hospital going, everyone has worked exceedingly hard through very, very difficult circumstances. So we are very, very grateful and thankful for what each and every one of you does. What sometimes is not seen, because it's done behind the scenes, really, many times in these early morning calls, is how well the hospitals have worked together. Hospitals that normally will compete have put that aside to save lives, have put that aside to work with us as we battle against this COVID. Early on, we adopted what the hospitals had done, and this is a division of the state into 8 separate segments, 3 hospital zones. And you may hear some of the doctors today talk about these different zones. With the zones, there's been leads, and they have, again, coordinated between one hospital and another hospital taking patients. And as we've seen this surge, that has been vitally important. So again, I thank them for that great cooperation. This morning at the 6:30 call, After getting the different reports, after hearing from the National Guard, the hospitals asked me to deploy more members of the Ohio National Guard, that they needed those and they needed us to start moving on that. So earlier today, I asked General Harris to begin the action to mobilize an additional 1,250 members of the Ohio National Guard. This is not something that we do lightly. These are our fellow citizens, the women, the men. We are asking them, by mobilizing them, to leave their families. We're asking them to leave their jobs. We're asking them to leave their homes. So it is a huge sacrifice, and we are very grateful for their willingness throughout this pandemic to do that, become mobilized and take the actions that they need to do, whether that was giving vaccinations, whether that was before that doing testing, whether that was helping with our food banks. All the way through this, the National Guard has been there. So I'm asking General Harris again to start the process to mobilize an additional 1,250 members of the Ohio National Guard. Let me now go to General Harris to give you a description of exactly where the Guard is now deployed around the state in regard to our hospitals. General Harris.
Thank you, Governor. And as I talk through this, sir, I'll talk in general terms about the numbers. And the reason I say that is because this is a snapshot in time. One of the things we've learned already during this, this early in the response, is that we, as we learn, the ability to shift forces and move the resources to where the hospitals need them is going to be a great asset to us. So I'm talking about a snapshot right now because the picture may look very different as we shift resources from day to day. But preponderance of our forces are in the Cleveland area right now. We do this in coordination with the Department of Health and the Ohio Hospital Association, identifying where the hotspots are and where to put our most critical assets. So we have over 460 people currently deployed just in the Cleveland area to help take some of the strain off the hospitals there. We have, again, north part of the state, the Toledo area, we have over 160 people there. We have people in hospitals here in Columbus, about 100 people there, again, approximately. And then we've got smaller numbers in the Mansfield area. We have, or we'll have in the next couple of days, about 40 people in the Dayton hospitals, Miami Valley, and even in Lima, as far west as Lima. We'll have both medical and non-medical assets there.
As we've discussed this, as you pointed out, this is a very fluid situation that we knew when we started that these members of the National Guard would be moved around. And as this hospital challenge maybe moves from the north down to more into the central and then maybe more in the south, I assume that your work with the Hospital Association, with the State Health Department, will give us enough. We'll have the flexibility to move some of those when the time is appropriate to do that.
Yes, sir. We meet with them, and our planning teams meet literally daily, and we look at the numbers daily, and we have the ability to lift and shift our resources as necessary to meet that demand. And that's important because we also, not only do we change the numbers of resources at a specific hospital, but also the mix between medical, those clinical folks, and the non-medical people, those people who are doing missions like transporting patients to help expand the capacity of the hospital, or helping with environmental services or food service, or even just basic administrative tasks. So the goal here is to expand the hospital's capacity, because most of the hospitals tell us they have their challenge is not shortage of beds, but shortage of staffing to staff those beds. So as we put medical providers in, and as the hospitals look for ways to increase that capacity, it also increases the demand for those other services, what we call wraparound services. So the Guard really has two missions here. One is augmenting the medical staff, and the other is augmenting the wraparound services as the hospitals expand their capacity.
Well, General, we're going to ask you to stay on in case there's any questions for you. And we appreciate what you're doing. We appreciate what your men and women are doing. We appreciate their sacrifice. They've been a godsend as we've gone through this pandemic. I don't know what we would have done without them. So thank you very, very much.
Sure.
Let me now go to Dr. Operation Officer of the Cleveland Clinic. Dr. Wiley is zone lead one up in the northern part of the state. Dr. Wiley, you want to just, if you could, maybe tell us some of the things, share with some of the with the public some of the things that you shared with us this morning on the call.
Thank you, Governor, and thank you, General Harris. First of all, the governor's mentioned that we have over 5,000 people hospitalized in the United States, but let's put that in perspective. Adjusted for the size of the population, that is the highest rate of hospitalization for COVID of any state in the United States. We also have a positivity rate in terms of testing of over 24%. That's in the top 2 states in the United States. So what does that mean to the zone, which extends from Youngstown to Toledo, south to Canton and Dover, New Philadelphia? It means we have over 3,000 people hospitalized within just the northern part of the state. And today we set a record, not only for the entire zone of over 3,000, but we had the highest number we've ever had in the Cleveland and the surrounding area of nearly 1,500. And in the Akron-Canton area, 1,111. As we look at the individual county, take one like Cuyahoga, which is the highest in the state and one of the highest in the United States in terms of number of cases per day. We're recording nearly 3,000 cases a day, with Summit County to our south at over 900. As we take a look at the Cleveland Clinic, what does that mean to an individual healthcare system? Then I'll expand out to the zone because it means the same to the entire zone. I'm obviously most familiar with the Cleveland Clinic. Today is the first day since the pandemic started. We started with over 1,000 patients with active COVID in the hospital. We had over 210 of those patients in the ICU and under critical medical care. As we look at the rest of the things that we're dealing with, our caregivers, our nurses and our environmental service workers and our doctors are getting COVID just like everybody else is in the community. This morning, we had the highest number of people out that we've had since the pandemic started. Over 2,700 of our workers were out. Now we're contacting them with the new CDC recommendations to see how many are well enough to start to come back in. And that's going to be a couple hundred in the next couple of days, but still, this is a remarkable number of people out. All the hospitals in Northern Ohio have stopped elective surgery. They've started to bring people who are not necessarily in clinical care all the time, like research nurses and quality health nurses, back in to work within the hospitals to try to take care of these COVID patients. So what I wanted to stress is the hospital systems are under significant stress in Northern Ohio. One of the things that we've been helped with, as General Harris said, is the National Guard in terms of setting up a testing center, because our EDs were very challenged with people going to get testing in the ED. Now they're going to the Walker Center. We're running 2,000 tests a day. But let me tell you about those tests. 36% of the people going into the Walker Center for testing are testing positive for COVID. That's a remarkable number, much higher almost than any other state that we're seeing in terms of the testing positivity rate. So I just outlined a few of the challenges. We have many people out with COVID or under quarantine. We have a lot of people in the hospital with COVID. We have a very high testing rate, which is going to predict moving in the future. We're probably going to increase the hospitalizations. We've already cut back on elective surgeries, and now we're starting to core down in terms of our actual sites of surgery and bringing them in so that we can take care of the most essential surgery in all the COVID patients and all the other patients with heart disease, neurologic disease. So, Governor, I'll flip it back to you.
Well, Doctor, thank you. Thank you very, very much. Thank you for what you and your team are doing. We're very, very grateful. Let me now go to Dr. Richard Lofgren, CEO, UC Health down in Cincinnati. Doctor.
Thank you, Governor. And I would like to start out by thanking you, Governor, and Major General Harris for your leadership and support during this time, because it truly is a crisis in our healthcare system right now. And at times, I really feel like our community doesn't fully appreciate what's happening in our communities related to that. You know, unfortunately, the pandemic is not over. And as you just mentioned, we are seeing more cases now than we've ever seen along the way. And I'm in Southwest Ohio, and right now we are besieged with the surge, but nowhere near what Dr. Wiley's experiencing to the north. Throughout the fall here, we've seen this huge surge with Delta, and now the spread of Omicron is just adding fuel to this raging fire. And as mentioned before, in some of our communities, 1 in 3, 1 in 4 patients in the hospital right now have COVID. And one of the things I think that I want to make sure that people understand is that this not only affects the care of the people with COVID, but also affects people who don't have COVID. It squeezes out our ability to take care of patients with other life-serious and life-threatening problems such as heart attacks and strokes. And to hear the stories around the state that I do from my colleagues when we're on our calls are really kind of gut-wrenching. You hear about people coming into the emergency room and they can't breathe and immediately need to be on a ventilator. And yet they sit on a ventilator receiving critical care in the hallway in an emergency department, waiting 1, 2, 3, 4 days to get an ICU bed. I mean, it's just not the ideal setting for a patient, for their family, and frankly, for their staff. I think the other thing that I appreciate is that it seems like the stages of this pandemic has been defined in many respects by shortages. Initially, we were scrambling because we didn't have enough PPE and protective equipment. Then it was testing, and then it was the vaccine. Well, right now it's staff. The healthcare workers and frontline workers through last winter did incredible heroic things to really take care of our community. Double shifts, overtime, really extended themselves in a way that's incredible, but not sustainable. And as we see right now, we've had the staff that are just worn out. They've left the industry. And so the real issue that we have right now is, as Major General Harris mentioned, isn't, we have plenty of PPE and equipment. We simply don't have the staff. And the National Guard is really going to be, I think, an important augment to that. But again, I want to make sure to convey that really the issue here is that we need to do those things that we know make a difference. I know it's painful. It's painful for all of us in the holiday seasons, but we got to double down on those things that you mentioned that work. The most important thing is getting vaccinated and to get the booster. I also think with a variant like Omicron in our community, which is so contagious, that means the things that we do and simple things like wearing a mask indoors is really a way in which we can mitigate and reduce the spread, allow our hospitals to care for our community as it has done in the past.
Doctor, thank you. Thank you very much. These viruses go through different stages and in different places. What is your best estimate, or do you have any in regard to what they're seeing in the north? You may be seeing in the Southwest.
Yeah, we monitor the data on a regular basis, working through ODH and the Ohio Hospital Association and model it. And I think that we are seeing that when we see a hotspot in one area, it does spread through the entire state. It may be urban going to rural, it may be north going to south. And I think we're seeing data that certainly says, and I know that we continue to see a rise in Southwest Ohio. That's not as dramatic as what we're seeing in the Cleveland area, but my fear is that we're only a couple of weeks behind.
Okay, thank you. Let me now go to Jennifer Hollis, critical care nurse, Riverside Methodist Hospital. Thank you for joining us. We appreciate it.
Thank you, Governor DeWine, for having me here today. I just want to bring everybody to be able to walk a mile in my shoes and kind of understand as a critical care nurse what I am seeing on a daily basis that I am coming into work. It is beyond difficult. Our beds are full. There's nowhere else to go, and we are just as short-staffed as everybody else is seeing as well. So anywhere that I can come in, might have a flex assignment. And at that same time, so does my coworker who is sitting right next to me on the same pod. So what a day looks like when we're coming in is the constant beeping of ventilators and IV pumps. And we're wondering, where is that beeping coming from? And we are rushing, praying that it's not a life-saving medication that is beeping in that room, because I might be caught up in another isolation room and heaven forbid I'm missing something. And that is always our biggest fear, is that we are missing something because we are so maxed We are tired and we are frustrated, and we want the best for all of our patients and all of the family members that are coming. And that seems to be the hardest thing of everything that we constantly feel that we are bearing the weight of, is the emotional support that we are needing to constantly provide for our families who cannot be there sometimes because they live 2.5 hours away, or if it's because they feel the weight of the world on their shoulders for feeling guilty because they are the ones that gave their loved one laying in that hospital bed COVID. And that is something that is beyond unbearable, to feel that, there's nothing that no more can do. And for everybody that is scared of this vaccine, I ask you and beg you to look at the complications that come with the medications that we have to do to save you after you already have it, or the effects that happen from having a ventilator, a tube down your throat for that long, for laying in a bed for that long. We always say that for every day that you lay in that bed, it's as if I lay down in a bed for 3 days and didn't move, the muscle atrophy and everything that goes along with that. It's not just about the medications, the vaccine. It has to do with everything. And if I can do anything to help prevent that, I'm begging you to please get vaccinated. Please help our ERs. Do not go to our ERs just to get tested. And please, if you are symptomatic and can't get a test, because I understand that from what I'm hearing, that those volumes are low, just stay home and quarantine and follow the CDC and ODH guidelines.
Well, thank you very much. I can't believe the emotional toll this must take. When you're dealing with families, you're dealing with people, who have that COVID, and you and your other nurses throughout the state have been doing this for, unfortunately, not just months, but now into years. I mean, how do you deal with that?
I would be lying if I was saying I dealt with it well. I'm grateful, that we have a lot of counselors and we have a lot of support that help us through it, because it's hard because we take it home every day. There's not a patient that I'm not thinking about, that when I come into work and I'm wondering what happened to that patient that I took care of the day before, and all I'm thinking in my head is I'm praying that the family got there to be able to say goodbye. That's really hard. And I will continue to stand here, and I've said it before, I will continue to fight for you, even when you will not fight for yourself.
And again, what do you ask people to do?
Please get vaccinated. Please get vaccinated. Get your boosters. Quarantine if you are symptomatic. Get tested and ask questions to people who understand the evidence. And we're here listening to you guys, but please get vaccinated.
Well, thank you for what you do. Thank you for being on today, but thank you for what you've done and what nurses and medical professionals are doing across the state and have done now, unfortunately, for a long, long time. We cannot express our gratitude enough. Words are not adequate, but we are very, very grateful.
Thank you, Dr. DeWine. Thank you.
Dr. Vanderhoff, I don't know if you have anything else to add, and then we'll go to questions.
Well, thank you, Governor. I think, unfortunately, the picture that you and our guests who are on the front lines have painted is that of a very serious situation. We're looking now at an impact of COVID-19 that is unlike anything we've seen before in this pandemic. But the good news is, and you just heard this from Nurse Hollis, that we have access to a powerful tool that can really shield us from the worst outcomes of COVID-19, and that's vaccination. So if you have yet to be vaccinated, our plea is please get vaccinated. If you're due for your booster, that's very important. Get your booster, keep your vaccinations up to date, help your body be able to fight COVID-19, particularly as now we're on the threshold of dealing with this new variant, the Omicron variant. The vaccination not only protects you, it's going to protect the people you care about. And we just heard a very touching description of how important that is. So we have to think not only about ourselves, but the people around us. And with COVID spreading like wildfire, there is really no better time to choose to be vaccinated or to get one's booster. Thank you, Governor.
Doctor. Dan, we're ready for questions.
Governor, first question today is from Laura Hancock at cleveland.com.
Happy New Year, Governor. I am just wondering, the Ohio State Hospital Association, as well as the 6 members of the Children's Hospital Association, have sent out a letter, which they sent to your administration, asking for children to be required to wear masks at school. And I was just wondering if you are planning to make that a requirement statewide. I believe we did have one this time last year.
The letter that went out from the hospitals, children's hospitals, as well as some of our zone leads around the state, I think summarizes very well this point. If you're a parent, if you're a superintendent, if you're a school board member, if you're a teacher, we all share the same goals. We all want our kids in school. We want them to be able to start back on Monday or whatever day you start back on. And we want them to be able to stay in school. There's 2 things that all of us need to do if that's going to be possible. One is for the parents, make sure that child is vaccinated. Number 2 is for the schools, at least until we get through this horrible surge that we are in. The schools need to require masks. Masks work. They slow the spread. It's very, very important for the schools to do that. Let me ask Dr. Vanderhoff to comment further on that.
Yeah, thank you, Governor. You know, what we saw was that our hospitals, the people who are actually on the front lines taking care of the sickest of patients with COVID-19, have turned to the schools and asked them to apply what they know works. Of course, we're emphasizing vaccination. Very important. The governor shared that our data continues to show that it is largely the unvaccinated who are ending up in our hospitals. But in addition, we have another very good tool, and it's a tool that's proven itself over the course of more than a year in our schools, and that's masking. So at this time, the people who know, the people who are taking care of sick children and sick adults are turning to the schools, turning to parents and saying, please, let's use the tools that we have at hand that have proven themselves to be so effective: vaccination and masking.
Doctor, I wonder if you could comment about what we're seeing in other countries in regard to the spread of the Omicron. My understanding from what I've read, and frankly from also talking with you, is that this spreads a lot faster than anything we've seen. Very, 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 very contagious. And that what other countries are seeing is that there is an increase in number of children going to the hospital. Not a huge increase, but an increase, a marked increase. And it's my understanding that comes about not because the Omicron is more lethal or more tougher, but rather it's just infecting so many more kids. And so you start with a bigger number, and even though it might not be as, in some ways, as serious as Delta, but when you got that big number, you ultimately end up with some increase in kids in children's hospitals.
Yes, Governor, that's absolutely right. So one of the pictures that we can look at is what's happened with Omicron in the parts of the world that are ahead of us on this Omicron curve. And we can certainly look at what happened in South Africa and now what is happening across Europe. And it is clear that Omicron is spreading, and I use the word like wildfire, across Europe. It's spreading at an incredibly fast pace. And early indicators here in the United States are just reaffirming that fast spread. Now, with that, it means that you have, of course, more people who are at risk for potentially developing severe illness. And as we have seen heretofore, It is the unvaccinated, including unvaccinated children, who then become at risk. So as the pool of children who are infected with COVID-19, with this Omicron variant grows, with the exponential rise in these cases, more children are at risk for hospitalization. So the proportion of people who get sick enough to end up in the hospital with Omicron does appear to be lower. But when that denominator, that number of people who are actually impacted, gets to be so large, it's inevitable that you're going to see an absolute number of people in the hospital grow. And sadly, this time around, our children are also going to be vulnerable. So we really do have to take steps, masking and vaccination, to protect them.
Thank you, Doctor.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Thank you, Governor DeWine, Major Harris, and Major General Harrison, everyone on this call. I want to ask about the numbers. If someone tests positive from a home test, what are their obligations to report? How do they do that? And with the lack of testing capacity, what does ODH estimate the real number of people who have COVID is? And given that a lot of them can't be tested.
I'll let Dr. Vanderhoff answer that. Just a couple thoughts in regard to that. We have put out, I'm looking for the number, 1.4 million tests this December that have come from the state that we have distributed many times to the libraries, many times to the local health departments. We're going to continue at about that pace or close to that pace. As fast as we can get new tests in, we're going to get them out. And I told our team in December, when people were getting ready for Christmas, let's get them out. Let's don't hold anything back. Let's just move quickly on that. That represents a relatively small number of the total number of tests that were in all likelihood taken in December. We know that a lot of the quick tests that people are buying, they are not reporting, but we felt, and this wasn't even a close call, that even when people are not reporting, letting them have that information themselves so they can make rational choices themselves. And with that piece of information is very, very important. So I won't say we didn't, Joe, we didn't, it's not that we don't worry about those ones that aren't reported, but we know that a lot of these quick tests are not going to get reported, and we're willing to accept that because we think that there's a lot of good for people to be able to take a test, know at least in that snapshot of time whether or not they are positive, and decide to go to Thanksgiving or decide to go to Christmas with others. Dr. Vanderhoff, you want to take that from there?
Yeah, thank you, Governor. I think the governor actually summarized the picture incredibly well and accurately. As he noted, we've distributed an incredible number of tests. Ohio, of course, was one of the first states to prioritize widespread distribution of free rapid testing kits. And over the last year, we distributed about 5.2 million of those free kits and 1.4 million of those in December alone. So there's been incredible demand, and we've been racing to get those tests to people to meet that demand. In fact, we're seeing, thankfully, incredibly high numbers of Ohioans getting tested to the tune of about 40,000 plus a day. And more than 250,000 Ohioans were tested just during the week leading up to Christmas. So, we know that people are taking advantage of the opportunity, thankfully, to get those tests and find out what their status is. Now, one of the things that tells me that while not every test is able to be recorded, that we're getting a very good snapshot, a very good picture of the activity that's happening, is that we can see now an unprecedented increase in the number of tests that are coming up positive and are actually being reported into us. We're now up to about a quarter of all the tests that are being administered across the state coming up positive. You heard Dr. Wiley reference the number that the Cleveland Clinic is seeing higher. But as we look across the entire state, still very high, perhaps not quite there. What's important is that Ohioans who are eager to do the right thing have the information they need. That's more important than us necessarily being able to capture the result of each and every test for a population surveillance perspective.
Again, look, we know there's a lot of people who are testing positive. Is that number probably higher than we're reporting? Yes, because people who are doing their own tests are not reporting that. But the really important thing today is what we've talked about in this press conference, and that is hospitalization. That is where we have to absolutely focus. We are at a different stage now. We have vaccines, we have them available. Our emphasis is on getting the vaccines out to people, encouraging people to take them, encouraging people to get their boosters. What we know from case numbers is always informative, is always interesting, helps us understand, the scientists and the doctors understand what's going on. But what we have to really concentrate on, we already know those numbers are very high. What we really have to concentrate on is what is going on now in our hospitals and in getting more people vaccinated.
Next question is from Caroline Sweeney at WEWS in Cleveland.
Good afternoon, Governor and Major General Harris. This question is for the two of you. We know that healthcare professionals are leaving the industry because of burnout. We know that with the nature of this virus, there could be another surge in the future. How sustainable is this plan for the National Guard members to come in and supplement, work inside the hospitals? How sustainable is that? And if there is a long-term plan for them to continue to come in, what does that plan look like?
Well, let me start off. No one wants to see this as a permanent situation. I don't think anyone expects it to be a permanent situation. From talking to our heads of our hospitals, talking to our medical professionals, we are in a surge. We have to deal with the surge now. We do not expect this surge to last forever. And if it follows, and Dr. Banhart, you might want to comment before we go to General Harris about what we're seeing in other countries in regard. We're seeing the Delta now go down. It's being replaced by the Omicron. You might comment on what, I know you don't have a crystal ball and can't tell us how long this Omicron is going to be going, but what are we seeing in other countries from Omicron?
Yeah, thank you, Governor. So the big picture is that first, we do see that where Omicron is competing with Delta, for example, across Europe, Omicron is replacing Delta as the dominant variant and doing so very, very rapidly. Early indications are here, right here in Ohio and the region of the United States where Ohio sits, that same pattern is repeating itself. If we look at the CDC's estimates, it's modeling for where they believe Omicron is in our region of the country. They have us pegged in the neighborhood of 68% of the viral types in Ohio, in the region we sit in, is in that ballpark. But if we look at the place where it started, South Africa, Omicron took off like a rocket. It moved almost straight up, infected an incredible number of people, peaked, and now appears to be in a state of fairly steady decline again. So unlike some of these other surges we've seen, it has had a more narrow window. And as you pointed out, I don't think any of the experts are anticipating that this will be a perpetual state of affairs.
General Harris, you want to comment?
This is a great question because it really leads to the discussion about Ohioans getting vaccinated. and protecting themselves, because we're here to protect critical infrastructure, and we consider the hospitals during this crisis critical infrastructure. And we're one of the many fingers in the dike that Governor DeWine has ordered to help that critical infrastructure through this surge. It's certainly not our intention to stay in the hospitals, but we'll stay as long as the hospitals need us. But I guess the question would be, how long does Ohio consider this response sustainable? Remember that every person that the National Guard deploys or mobilizes is coming from somewhere. So how long is it sustainable for your local restaurant to be with a degraded workforce? How long can an already strained supply chain go without those CDL drivers and those people who work at warehouses and whatnot? Because those are the very people that we're mobilizing to protect this critical infrastructure right now. So really what we're doing is just shifting the pain point to the hospitals where it's most needed, because we recognize that we're creating pain in other places. So our intent is to disengage from the hospitals as soon as the Department of Health and the Ohio Hospital Association tell us that it's okay to disengage from the hospitals, so we can get our members, our guardsmen, our soldiers, our airmen back to their families and back to those places in the workforce where they're so important to our economy here in Ohio.
Thank you, General. The members of the Guard will not stay one day longer than they're absolutely needed.
Next question is from Sean Haggerty at WTVG in Toledo.
Good afternoon. A question. We understand that the Guard has been mobilized at the Fox Run facility down in Findlay. What is the plan for the Guard to be in these small specialized units, not the big hospitals, but in these small places where they're needed?
The National Guard, even prior to the pandemic, every once in a while, we have a situation, for example, in a nursing home, where for any number of reasons, they no longer have the staff they need. We have vulnerable people. There's no one to walk in the door. When that happens, the Ohio National Guard walks in the door. And so we do that, and we will continue to do that whenever it's necessary. It's not a very usual situation with nursing homes, but occasionally it does in fact happen.
Next question is from Mariel Carbone at WCPO in Cincinnati.
Hi there, and this is for either General Harris or Dr. Lofgren. I was just wondering, I know that there was numbers mentioned for how many guardsmen were around different parts of the state, but didn't hear anything for Southwest Ohio. So I didn't know, are you guys in this region? And also, why does it seem like the need might be more up north? Why are we surging more up there than in the Southwest region of Ohio?
General Harris, you want to take the part of the question having to do with where deployment is?
Yes, sir. Right now, Dayton is the only place down in the southwest part of the state where we find ourselves. And again, that's based on recommendations and building the deployment matrix in partnership with the Department of Health and Hospital Association. I can't answer the question as to why. I think it's more for epidemiologists to answer that question as to why it's higher in the north right now. But I can tell you that when we look at the charts, there is a significant difference in the levels in the northern part of the state, particularly in the Cleveland, Akron, Canton area. But we certainly anticipate that we'll see similar activity of this disease all over the state, which is why I mentioned earlier, we have to maintain our ability to lift and shift resources, to be agile as we do that. Our service members, our soldiers and airmen are expecting that. And that includes the previous question also about nursing homes or other specialized care facilities. To be able to allocate those resources where the crisis is most dire is something that's built into our planning for this operation, and that we are incredibly vigilant about, because we know it's important to our mission partners.
One thing I would add then to your question is really that, as Major General Harris mentioned, is there is constant dialogue across the three zones and within the three zones about the activity. We monitor it daily. We have conversations about it. We understand the pain points. We understand which hospitals are in diversion because they can't accommodate that. We shift patients from load balance in the regions within the zones. And really what you're seeing right now is that Southwest Ohio does not have the crisis that they do in the north. And this is where, as Major General Harris mentioned, is constant dialogue. And I fully anticipate that we'll be shifting resources as this latest surge, and particularly as Omicron starts to sweep across the state, the demand will likely shift. And we'll see the deployment of the resources and assets to accommodate them. But right now, as overwhelmed as the hospitals are in Southwest Ohio with COVID patients and in non-COVID care, it's not in the same situation at this point in time as we're seeing in the northern part. So it's the fact that we have dialogue and data that we follow on a regular basis that really determines these kind of decisions.
It certainly is a day-to-day conversation. And I think the thing that Ohioans should feel good about is that all the hospitals have put aside any kind of differences they might have, whether it's geographical or competition or whatever it is. And everybody agreed when the decision was made to send in the National Guard to our hospitals. Everybody agreed all the way through this, we're going to be guided by where they are needed most today. And so 2 weeks from now, it may be it may be different in 2 days or 3 days from now. But I think it should give people confidence that everybody's on the same page here. Let's deploy them where they're needed the most.
Next question is from Amanda Jern at MahoneyMatters.com.
Hi, good afternoon. Conversations around COVID-19 have turned to the pandemic becoming the endemic. Can we also expect the state's healthcare system to grind to a near halt every winter, impacting wait times for non-COVID care? And can we expect regular National Guard deployments based on the pandemic severity? And also expect another 14,000 additional deaths in Ohio every year? So if it's never going to get better, how is the healthcare administration in Ohio going to have to change to accommodate this new reality? Thank you.
Well, I'll let Dr. Vanderhoff take that, but I want to start. We do not expect this to last forever. Things will get better. Things are going to get better. I think every doctor who's looked at this, every expert, but we've got to do what we have to do today. And that's what we're worried about. Dr. Vanderhoff?
Thank you very much, Governor. I would agree with your comments. One of the things that we have to recognize is that as we look now at the advent of Omicron, as infectious as it is, as contagious as it is, the good news is it's already demonstrating that it is less likely to cause severe illness than some of the variants that preceded it. There's every indication that we are in a process of moving towards a virus that is more endemic. However, we have to remember that it also means that we do have to learn to live with COVID-19, which means we all have to take the reasonable and appropriate steps we need to take to protect ourselves and others from COVID-19, just like we have to take those steps with other viruses that are endemic and we've learned to live with, including the flu. So I think you'll continue to hear healthcare leaders, your own doctors and other healthcare providers advising and recommending, for example, that you keep your COVID vaccinations up to date, that you get a COVID vaccine if you haven't yet, and that each winter, as we face the respiratory virus season, all of us take steps to protect ourselves, being very mindful of what we have to do to limit the spread of respiratory viruses. So I think COVID is here to be with us for the long haul, but I don't think any of us are anticipating that we will continue to live in at the state that we have had to endure during these early years of the COVID pandemic.
Next question is from Titus Wu at the Columbus Dispatch.
Hi, thanks for doing this. I guess my question is, first, of the additional 1,250 members that are being deployed, how many of them are EMTs or medical staff? And then also, this National Guard deployment, this is obviously, a temporary fix. It can't, they can't be there forever. I guess, and this is for anyone, like what ways could there be a more kind of a permanent solution to kind of this understaffing that, the legislator or others can take action on?
Yeah, I mean, again, we do not expect this surge to last forever. It is not going to last forever. So, when members of the Guard are deployed along our southern border, they're there for a year. When they're deployed overseas, it can be a lengthy time. We do not anticipate anything like that in regard to this deployment. But as General Harris said, they will be there as long as they are needed. But this is not something that we look at as this is how we staff our hospitals, or this is how we handle our public health problems on a permanent basis. I don't know, Dr. Vanderhoff, you want to add anything, or General Harris?
Yes, sir. I will add that we don't expect to see many medical providers, clinicians in this next wave. We've been very deliberate as we've screened each one of our critical medical folks to ensure that we don't cannibalize the capacity that already exists in the hospitals. In other words, if we've mobilized a medical professional, they're that person that the governor spoke of earlier. Dr. Wiley spoke of earlier. There may be a person who's being pulled from a different department that's not critical to the ICUs or the emergency department. Those are the kind of medical professionals that we've mobilized, and we've been very particular about that. And the rest of them, we need to leave on their civilian jobs in their civilian workplace so that they continue to do what they do. So this next wave, I don't expect to see many of the clinical medical folks in that batch, simply because we've already sorted through them and mobilized what we think is safe for Ohio to mobilize without degrading the capacity of the hospitals that so desperately need it right where it is.
Governor, I think you and the general have covered it very well. Thank you.
Next question is from Alex Ebert at Bloomberg.
Good afternoon, folks, and may you all have a blessed and better 2022 than we had this last year. This question is for Dr. Wiley. Last November, you had a call like this with most of these people on board, in which you raised alarm bells because there were 300 individuals with the Cleveland Clinic that had COVID-19 or were quarantining in order to protect the rest of your staff. It has been quite a year, sir, and now it looks like you're reporting about ninefold that amount of individuals that are out. Tell me the difference qualitatively between what's happened over the last year and what you're facing now, and what life would be like at the Cleveland Clinic without the National Guard members that are helping us during this time. Thank you.
Well, let me start with the last part of that question first. The National Guard has been indispensable in terms of helping us not only at the Walker Testing Center and decompressing our regional EDs for all the hospitals in Cuyahoga County, but also in helping us staff our hospitals to deliver food trays, to transport patients, to do all the other non-medical interventions that we need to run a hospital. We certainly have had a significant increase in the number of people out. It's gone up and down throughout the year. Right now we're seeing an up, and that's really part of the press conference today, because there's a lot of things we can't control, but the one thing we can control is the people who are in the hospital who have COVID. So 80% of the people in the hospital have not been vaccinated, and over 90% of the people in the ICU have not been vaccinated. So what we're really asking the public to do is to help us and start to reduce the number of people in the hospital so that we can manage all the other things that we have to manage, the strokes, the heart attacks, the neurologic disease, everything else that we need to provide medical care for. The one thing that the public has control over to help us is to get vaccinated and get boosted when that time is appropriate.
Next question is from Candace Price at WHIO in Dayton.
Can you all hear me now?
Hear you. Thank you.
Awesome. Thank you. And thank you all for doing this today. I really appreciate it. My question, and I'm sorry if this was already answered, I had to hop off for a minute. With the situation in the state right now, as bad as everyone is saying it is, are there plans in the near future to, do mask mandates and those sort of things that we've seen other states doing to sort of slow down the spread right now?
We have no plans to mandate mask, but with what is going on today, if people want their kids to stay in school and schools not have to close down, not because of what the state says or medical people say, but they want their kids to be able to stay in school so the teachers will be able to teach. Kids will not be out a lot. School bus drivers will not be out a lot. The best way to do that is to wear a mask. And, we're into a very difficult period of time right now. We're seeing the Delta variant that is driving most of the hospitalizations, we believe. We're also seeing the Omicron, which we know spreads very, very quickly and is spreading across the state of Ohio. It's much more contagious. So again, I would urge everyone to think about kids go back to school on Monday. Parents, have your child wear a mask. I know people don't want to do that, but that is the safest thing. And for school superintendents and school boards, school administrators, please consider putting the mask mandate on if you don't already have it on, at least for a few weeks while we are at this great surge. We don't have practical ability to really put on a statewide mask order at this point. I don't think it's appropriate at this point. We have the vaccine, we have the tools. But I would really urge for the schools to do what we have seen the children's hospitals said today. Very, very strong letter, very, very powerful letter. Children's hospitals saying, please, please have a mask mandate on when kids start back to school on Monday.
Next question is from Dan DeRose at WOIL in Cleveland.
Good afternoon, Governor. Kind of on that same topic, it was just announced by the Cleveland Metropolitan School District that they are going remote next week, that they will take that first week at least to keep kids at home. Is this something you see happening more and more across the state? Is this something you would hope would happen because of this latest surge?
Look, I think none of us want to see kids out of school. We want kids in school. I won't go through all the reasons why we need kids in school, but that's been articulated very well. It's been particularly articulated by pediatricians and particularly articulated by our children's hospitals. So what I would prefer is people listen to our children's hospitals in Ohio. And what the children's hospitals in Ohio are saying is wear a mask. They're saying require masks for your school. They're not saying close schools. They want your kids in school just as much as you want your kids in school. But our children's hospitals are begging you, knowing what Omicron has done in other countries, they're saying, please have children wear masks. And even for schools that have not done this for a while, I would ask them to consider it. It will make a difference, but we want our kids in school.
Next question is from John Reed at Gonwer News Service.
Good afternoon. For Dr. Vanderhoff and the other medical providers on here, there's been a lot of talk about, the importance of vaccination. What should people who are vaccinated do to reduce the risk of catching the virus, to reduce the risk of spreading it if they're asymptomatic? What advice do you have for people who are vaccinated?
Well, thank you very much. I'll kick it off and then turn it to my physician colleagues. The good news is that a lot of Ohioans have taken the important step of getting vaccinated. We have more than 6.4 million Ohioans who are fully vaccinated. So the first thing, of course, is to get the vaccine. It gives you that foundation of protection that's so important. But as we know from other vaccines that we receive, it's also important to keep that vaccine up to date. And that now means getting one of the 2 mRNA booster shots, either from Pfizer or Moderna. And that's particularly important for people who may have gotten the J&J vaccine originally. Getting a booster with an mRNA is going to be particularly important given the fact that emerging research suggests that the mRNA vaccines provide you with a greater degree of protection against Omicron. And that's very, very important. But we've said over and over again that while our vaccines are by design very good at protecting you from severe illness and protecting you from landing in the hospital, the way our immune systems interact with this virus means that even a well-protected, vaccinated person might develop some mild to moderate illness from COVID-19. And while for them, it will probably be like getting a cold, they can spread the virus. And so we all have to be thinking about, at a time when there's a lot of virus spreading around, what can we do in addition to vaccination to not only protect ourselves, but other people? And that's why when we're thinking about going into crowded environments, when we're thinking about being in indoor spaces with a number of people, especially if we're in close proximity, we should wear a mask. Let me turn to my colleagues because I'm sure that they can add a lot to this. Dr. Wiley, would you want to start and then maybe turn it to Dr. Lofgren?
Sure. Bruce, I think you articulated it very well. 55% of the state of Ohio is fully vaccinated. As of this morning, about 38 or 39% are boosted. So there's still a lot of opportunity for people to get vaccinated and even more opportunity to get boosted. And those are extraordinarily important against protecting yourself. And I would echo what Dr. Vanderhoff just said. One of the most important things, if you're already vaccinated, is when you're in a situation when you're around a lot of people and you don't know their vaccine status, or you haven't, and they haven't been tested recently, or you're getting the family together and you're worried about other people who are not vaccinated, such as those less than 5 years age or the elderly population who will be more susceptible even if vaccinated, that's a time to consider wearing a mask to protect everybody. With that, I'll turn it over to Rick.
Yeah, I think that I just echo, that particularly at this point in time, when you have a variant that is as contagious as Omicron, that the importance of masking indoors takes on a new special role. I know personally, if I'm in any indoor situation, I wear a mask. In fact, I think that the issues about even wearing these higher surgical masks or N95s to prevent the spread of this virus is important as well. So if you're fully vaccinated, you're doing everything to keep you and your family, your neighbors safe. Great that you've been vaccinated, great that you've gotten the booster, but the next thing to add is to make sure that you are wearing a mask indoors, maintain social distancing, the things we know make a difference. And the only other thing I would add is limiting the number of people you come in contact with. It is an issue about math, about how many people you come in contact. It goes back to limiting your bubble, which is incredibly difficult during these holiday seasons. But these are the things that will keep you, your family, and our community safe.
Next question is from Eric Halpern at WCMH in Columbus.
Governor, doctors, Major General Harris, thanks for taking the time today. New Year's Eve is just days away. Do you all have any concerns about numbers going up even more than what we're already seeing with those anticipated celebrations? And I know it might seem redundant from previous holidays, but what message would you have for Ohioans with New Year's just days away?
Let me defer to the doctors on this.
Governor, I think as we get ready to ring in the new year, our plea as medical professionals would be that you think about the steps that you can take to help prevent the spread of COVID-19 before you gather. Now, you've heard us in answering the last question talk about the importance of keeping your vaccinations up to date. That is foundational. That is really important. But you, I think, also should be thinking about maybe getting some testing before you gather, or staying home if you feel the least bit sick. We've talked about masking, especially in crowded indoor environments. Proper ventilation. Can windows be cracked? Can the gathering have some component that is held out of doors on a warm day? Again, we don't know what New Year's Eve will be like. And regular hand washing. All these things help prevent the spread of COVID. They help prevent flu and other respiratory illnesses. Finally, I'd add that if you have symptoms of COVID-19, which remember can include just mild cold-like symptoms, or if you test positive, it is vitally important this holiday that you stay home. This is much too infectious a virus for any of us to take chances with what we think might just be a little cold or a touch of the sniffles. If you aren't feeling well, stay home. Let me turn it over to Drs. Wiley and Lofgren to see if they have anything to add.
Bruce, I think you covered it well. Rick?
The only thing I would add that you touched upon, Dr. Van der Haa, is the importance of actually considering the ventilation. This is an aerosolized virus. It really is the air in which you breathe. And so it makes a difference in terms of ventilations, the HVAC systems within buildings, the height of the ceilings. That kind of thing is something we don't think about all the time, but those are the things that will continue to decrease the spread of this virus. It's spread through the air and sort of floats in the air, and you need to think about the ventilation. It's a very important added piece of ways in which you keep yourself safe.
Next question is from Jatara McGee at WLWT in Cincinnati.
Hi, everyone. Thank you for holding this call. Jatara McGee with WLWT. My question, I know that we clearly have an issue with illnesses in the hospitals and that impacting staffing levels, but I'm also wondering how things like vaccine mandates and burnout are impacting those staffing numbers. So when you look at the whole picture of staff members who are on board and healthy, or maybe not healthy, but on board in general, how do those staffing levels compare to last year? And I'm also wondering if we're looking to the federal government for help. I know strike teams were just deployed to Pennsylvania the other day. Are we considering something like that?
I'll take the first part of that. We are in discussions with the federal government in regard to additional help that they have offered. I don't have anything to announce at this point, but we are talking with them.
One thing I might add is that the issue around burnout is very real. Since last year, we've had a number of people in this, nurses who have in fact resigned. And you heard from the nurse Hollis about the emotional turmoil and trauma that they've gone through is very real. One thing I will tell you is that our vaccine requirements has not led to any kind of significant decrease in the staffing levels. Issues, in fact, it's the fact that we've had the requirement, I think, has helped protect our workforce. But the burnout issues and the people leaving the field, in Cincinnati, since I think so you're located, we started before the pandemic with a nursing shortage. We've only exacerbated it. I think there are almost 2,000 nursing vacancies in the greater Cincinnati area. It's a chronic problem that really was extremely exacerbated by the burnout and the demands of this pandemic.
At Cleveland Clinic, we're following the CDC guidelines, so we've not mandated the vaccine. We've encouraged it strongly. Over 90% of our employees are fully vaccinated, and the appropriate number are boosted as soon as they hit that 6-month mark. Like Dr. Lofgren just talked about, we've lost nurses due to burnout. I agree, it's real over the course of this almost 2-year pandemic at this point. It's been very difficult to guide families through, as we heard earlier in the discussion, in the intensive care unit where you're there alone, where maybe one family member or no family members are allowed in the rooms to try to prevent spread of the virus within the hospital. So these are very hard situations, and we applaud the nurses, but certainly recognize the stress that it's caused over the last couple of years.
Governor, next question is the last question for today, and it belongs to Donnie Subnosky of WSYX in Columbus.
It's actually Caroline. I'm sorry. I'm on our photographer's account. First and foremost, I want to thank all our healthcare workers, National Guard, Governor DeWine. We are appreciative of all you've done thus far. In terms of isolation and quarantine, the CDC's new guidelines this week, I think a lot of people are perhaps confused or questioning the 5-day if you're asymptomatic and then continuing the heavy mask wearing 5 days later. So can one of our healthcare professionals just kind of speak to why we do think that's a safe approach at this point and go a little bit deeper on that? I just know there has been some confusion.
Well, I'll just provide a very brief comment about that. The CDC, along with healthcare professionals across the state, have, of course, been continuously evaluating the evolving science, especially as we see Omicron beginning to take over. And what is very clear about Omicron is that it works much more quickly. It not only infects people more readily, it also establishes that infection in a much more rapid way. So we're continuing to examine very closely the recommendations that have come from the CDC, but this observation that a lot of the infectivity and a lot of the symptoms that people experience occur in within that 5-day interval is something that has been observed repeatedly now as it relates to the Omicron variant.
Well, let me thank you. Yeah. Well, thank you all very, very much. Really, in conclusion, let me just maybe summarize kind of my thinking here. We are Ohioans. We are resilient. We will deal with this crisis as we've always dealt with other crises in the past. We'll roll up our sleeves and get to work. In fact, we're doing that. Our nurses, our healthcare professionals, now our National Guard, they're doing that every single day. These professionals need our help. And when you listen to the medical doctors, as we have for the last hour or so, you know, it's abundantly clear what the medical professionals are telling us. We have been blessed with an amazing group of vaccines. Vaccines that, by and large, will pretty much keep you out of the hospital. The numbers are just overwhelming that show that when you go back to June, when everyone was able to get a vaccine and look at it. The vast majority of the people who ended up in the hospital, tragically ended up in the hospital, were people who were unvaccinated. So we know what the tools are. And I would just urge everyone to utilize the tools that we have. I want to wish everyone a joyous, happy new year. Fran and I look forward to watching the Bearcats play on Friday. And so we hope that when the New Year's comes, we'll be able to celebrate a Bearcats victory. We're very proud of them and proud that they are in the final throes of this, the Final Four. And so we're very, very proud of them and the whole organization. Happy New Year, everybody. Thank you.